My name is Dr. Jacqueline, and I'm a board certified psychiatrist. I'm going to be reacting to mental health posts on Reddit, anywhere from memes to relationship advice. Today, I'm going to be checking out a hot post from this week that is on the subreddit r relationship advice. So stick around to hear me give my expert insights onto the post. So here we go. My partner, 19F of 4 years, spontaneously got a face tattoo without talking to me, 20 male, and I'm beginning to question our relationship. Okay, I think that's reasonable. I too would question a relationship if somebody did something so major without talking to me. All right, getting into the details. My partner, 19F, and I, 20 male, have been together for 4 years. Okay, so that means that they met when they were in high school. As he just says, we met in high school when they were around 15 years old, and she became my first real partner. From the start, I knew she wasn't the best mentally, mainly because of her parents. Okay, so he's suggesting some type of abuse. I looked past this and have done my absolute best to try and bring her out of these rough times. I helped get her out of her parents' house. I helped get her a car, which she has missed many payments on and still owes me over $9,000. Okay. I pay for food for the both of us. I take her on vacations. I try my best to remind her to take her depression medication. I try my best to remind her to clean her house and her car. I do everything I can for her. Yeah, sounds like it. Although I've done so much for her to get her on the right path, when I ask why she hasn't done something, she says, "It's my depression. It's uncontrollable." And she makes very questionable decisions that aren't smart for her or my future. She dropped out of high school, then she dropped out of community college and was going to be a nurse, and now works at Walmart, where she currently wants to work for the rest of her life because they allow tattoos and piercings. She's picked up some tattoos along with many face piercings and dyes her hair regularly. I never stop her when she does these things, as it's her body and her choice, and I respect that. When she does these things, we usually talk it through and make sure that it's something that she actually wants to do and not a terrible idea. Yesterday, this did not happen. She posted it online saying, "I think it's time for a tattoo," but did not send it to me. I saw this post late, and before I could really question what kind of tattoo and where, she sent me a picture of it. She got a tattoo by her eye that says, "I know you don't like it, but this is who I am." Okay, so she got a tattoo by her eye and said, "I know you don't like it, but this is who I am." Okay, just rereading that because I actually thought that she got a tattoo that says, "I know you don't like it, but this is who I am," which I was going to say is like the most extreme Freudian slip I have ever heard of. I love this girl with my entire life. I know I always will, but it seems as though she has no regards for our future together. I worry that this may be a dead end. I worry about pouring my everything into a relationship just for her to ruin chances in her life and make it hard to live. I love seeing her happy and watching her express herself, but I feel as though she puts no thought into it at times. I'm not sure if I'm overreacting or if I'm hindering my own life by trying to make this work. I appreciate any and all advice. Thank you very much. All right, a lot to unpack here. So, part of being a mental health professional is using yourself as a tool. And when I have my antenna up, I am hearing codependency. So, codependency is I would say, actually a pretty common relationship pattern. And it is usually a very one sided relationship where I mean, really, this post just screams it. It's where one person feels like they're doing everything they can to make things right, to help the other person. It's really a relationship type that is marked by martyrdom. And it's interesting because codependent relationships were actually codependency as a relationship style was actually identified after a lot of research into families of alcoholics or individuals with alcohol use disorder and their relationships. And I think it's a good paradigm to think about because it's often the people who you have, the person who's using the substance or the alcohol, and it really just seems like they're doing everything to screw up their life. And then you have that other person who's doing everything they can to save them. They take all the alcohol out of the house, they spend their savings trying to send them to a rehab or something, but they do everything they can. I mean, he says it here, that he's pouring himself into the relationship, but she doesn't seem to respond. So The reason why, it's important to kind of identify relationship styles and relationship types is because before I would, if I were seeing, this young man, before I said anything about what he should do for his girlfriend, really it's all about self-examination. Yes, we can go through the comments and I'm sure all of them are going to be like, leave her, like, get rid of her, she doesn't respect you. But I think what this relationship is a good opportunity is for him to evaluate why he's even in this relationship in the beginning. So if he were in therapy, and he brought this problem to me, we would do a lot of discussions about past relationships. So the reason that it's important is that often the relationships that we are raised with, whether it's our parents or our siblings, these relationships are templates for how we're going to live our lives. And some people, they never examine the template. They just live according to what they saw. And if it's bad, it's bad. And if it's good, it's good. And, we can talk a lot about this, that this is, also think of this as a model for intergenerational trauma and epigenetics, which we can get into in another time. But the idea is that he really needs to step back and examine, why am I in this relationship? And so I would want to know, well, what was your parents' marriage like? Or, what is your relationship with your parents? And because, like I said earlier, codependency often occurs is in relationships where there is substance abuse and also mental illness, because there's often, again, that person who's trying to be the savior, the white knight, which is everything I'm getting from this post. I mean, just the beginning where he's like, I did this and I did this and I did this. It's like, well, why are you doing that? I think that's the first question. Why? Like, it's to help her, yes, but what's it doing for you? Um, and the children of, individuals with substance use disorder or people with mental illness are often what's called the parentified child. So before it's developmentally appropriate, they're often taking care of things. They're the kids, they're the latchkey kid who's taking care of the younger sibling. They find their parent hungover, they get them ready for work. Like, they're just taking on so much responsibility that that's what feels natural, is to be in that savior or caretaker role. So this may be the relationship that's comfortable for him, is being the caretaker. But now, as he's also in another developmental stage where he's sort of looking ahead and what he wants to do with his life, I think he's asking in this post, is this the right relationship style for me? And so I think that this is a great place to be for him. Um, I, I really think that he's doing his best. Um, but then there's always that question of, why is she reacting to you to be this way? And so now we can look at it from her side, from the female partner side, who got the face tattoo and told him, I know you don't like this, but this is who I am. So what I would say is, she is an individual who comes from a family with a background of trauma, and he's talked about how he had to rescue her for this. But what's important to remember is that, even though I think we assume, and people in relationships assume, like somebody with trauma, like they want to be saved and they want to be cared for. Of course, that's true. We all want that, but you have to keep in mind their template too. So if she grew up in a household where she was abused or she was neglected, she doesn't have that model for what it's like to be cared for. It's supposed to be natural in a sense for parents, when they have kids, they want to love their child, take care of them, protect their progeny, really, that biological compulsion. And there's a lot of reasons why people do or do not do that. But I think what we're getting to here is that she didn't have that care. Like, her parents didn't do these things for her that he's doing for her. So in fact, this amount of love and care he is giving her might feel very suffocating, and she doesn't know how to deal with it. So one way that we could interpret her behavior is by thinking about conscious and unconscious thought. So the easiest way to think about it is, think of the mind like an iceberg. So you have the tip of the iceberg right above the waves. And this is conscious thought, the thoughts that run through our mind that we're thinking about, the things that we say, the behaviors that we believe that we have control over. So for example, her dyeing her hair, or getting the face tattoo. That's conscious. She consciously made that decision to get that face tattoo. But then the unconscious part is the huge iceberg below the water. And so we know about the little tip of the iceberg, and then there's all this other like internal life thoughts we don't really have access to on a regular basis that are driving certain behavior. So if I would interpret this as a lot of the things that she are doing, she's making these decisions to unconsciously drive him away. So everything she does is a push to say, when is he going to leave me? When is he going to treat me like my parents have treated me? This is all I'm worth. I deserve to be abused. I deserve to be left. And this is the kind of work that has to be, I mean, it can be done with a therapist. It doesn't have to be done with a therapist, but it can be. But this is the kind of work that when you end up in that right relationship where somebody cares for you but gives you space, she can work through that. And like, she definitely needs that reassurance. I love you. I love you as you are. And I think he's trying to do that, but by taking care of her all the time and doing everything for her, unconsciously he's telling her, you can't take care of yourself. You're not worth anything. I have to do everything for you. So that's why it's really important to like step back from these type of relationship concepts and think about what's the dynamic underneath. So I think if I had to summarize this, it would be this is a codependent relationship for both of them. I wonder why he's acting that way. And then, we know that she has some trauma, and he may very well have his own trauma of a parent with substance use or mental illness. And it's time for him to use this as, a learning opportunity and think about, this relationship. And does he want this relationship to be the template for the rest of his life? Or does he want to learn from it and start to change that pattern? So if you liked this reaction, give me a thumbs up, subscribe to my channel, let me know what you think in the comments, let me know if there's anything else you want me to break down or react to. I'm really excited about this content, and let me know if you're excited too.